Tracer Academy for medical assistance.
Healthcare Assistant Interview Question and Answers Part 2. First question. Tell me about your experience as a healthcare assistant. How a nurse can answer this question? Let us see. A nurse can answer a question related to their experience in providing healthcare assistance by following these steps. First one, start by introducing yourself and your nursing background. Mention your years of experience, any specialist training or certification you have, and the healthcare setting you have worked in. Example, hospital, clinics, home care. Second point, provide a concise and relevant summary of the question or topic being asked. Make sure to understand the question clearly before answering. Third point, share a specific example or experience that relates to the question. This could be a challenging patient case, a situation where you had to make critical decisions, or a successful outcome you achieved while providing healthcare assistance. Be sure to maintain patient confidentiality and avoid sharing any personally identifiable information. Fourth point, describe the step you took or the approach you followed in addressing the situation. Highlight any evidence-based practice, protocols, or guidelines you adhere to while providing healthcare assistance. This demonstrates your knowledge and expertise in the field. Fifth point, discuss the outcome of the situation and any lesson learned from it. If applicable, mention how the experience has influenced your practice or improved your health skill as a nurse. Sixth point, conclude by summarizing the key point and relating how your experience in providing healthcare assistance has shaped your abilities as a nurse. Emphasize your commitment to delivering high quality care and your dedication to ongoing professional development. Remember to always maintain patient confidentiality and adhere to ethical guidelines while discussing your experience in healthcare. Additionally, it is important for nurses to be respectful and empathetic in their response. They should use language that is easily understandable and avoid using jargon or medical terminology that may confuse the person asking the question. The nurse should also be open to further questions or clarification if needed and provide appropriate resources or references to support their answers. It is important to follow specific organizational policies, laws, and regulations regarding patient confidentiality and privacy. So the next question can be, how can a healthcare assistant ensure patient confidentiality and privacy while providing healthcare assistance? A healthcare assistant can ensure patient confidentiality and privacy while providing healthcare assistance by following these practices. First point, obtaining proper consent. Before discussing or assessing any patient information, the healthcare assistant should obtain the patient consent to ensure they are comfortable with the sharing of their personal health information. Second point, using secure communication methods. Healthcare assistant should use secure and encrypted communications channels when discussing patient information, whether it is through phone calls, emails, or messaging platforms to prevent unauthorized access. Limiting access to patient records. Healthcare assistants should only access patient records on a need-to-know basis. They should not share patient information with individuals who are not involved in the patient care, ensuring that only authorized personnel have access to sensitive data. That's the fourth point. Maintaining physical security. Patient records and any physical document containing sensitive information should be stored securely, such as locked cabinet or password protected systems, to prevent unauthorized access. Fifth point, implementing strong passwords and access controls. Healthcare assistants should use strong passwords and change them regularly to protect electronic systems containing patient information. Access to patient records should be restricted to authorized personnel only through individual user accounts. Sixth point, proper disposal of patient information. When disposing of any physical document or electronic records, healthcare assistants should ensure they are properly destroyed, such as through adhering or permanent deletion to prevent unauthorized access. Seventh point, maintaining confidentiality during conversations. Healthcare assistants should ensure that conversations about patient information are conducted in private areas away from the hearing range of others to maintain confidentiality. Next point, continuous training and awareness. Healthcare assistants should receive regular training on patient confidentiality and privacy practices to stay updated on any changes in regulations or protocols. This will help them understand the importance of patient privacy and the steps they need to take to ensure it. Ninth point, adhering to legal and ethical guidelines. Healthcare assistants should strictly follow legal and ethical guidelines such as Health Insurance Portability and Accountability Act (HIPAA) in the United States to protect patient confidentiality and privacy. 10th point, reporting any breaches or violations. If a healthcare assistant becomes aware of any breaches or violations to patient confidentiality and privacy, they should report into appropriate authorities or their supervisors to ensure appropriate action is taken. The next question can be, how can a healthcare assistant prioritize and manage multiple tasks and responsibilities in a fast-paced healthcare environment? A healthcare assistant can prioritize and manage multiple tasks and responsibilities in a fast-paced healthcare environment by following these steps. First point, assess and prioritize tasks. Begin the day by assessing the tasks that need to be completed and prioritize them based on urgency and importance. This can be done by reviewing the patient's needs, the tasks delegated by healthcare professionals, and any time-sensitive data. Second, break down tasks. Break down larger tasks into smaller, manageable steps. This helps in organizing the workload and ensure that nothing is overlooked. Create to-do list or use task management software to keep track of the tasks and their progress. Third point, delegate when appropriate. Healthcare assistants work as a team, and delegating tasks to appropriate team members can help in managing workload efficiently. Identify tasks that can delegate and communicate with other team members to assign those tasks. Fourth point, communicate effectively. Good communication is a crucial in fast-paced healthcare environment. Clear and concise communication with healthcare professionals, colleagues, and patients help in understanding priorities, obtaining necessary information, and coordinating care. Regularly update team members on the progress of tasks and inform them in any challenges or changes. Fifth point, time management. Effective time management is essential to handle multiple tasks. Prioritize tasks before based on urgency and allocate specific time slots for each task. Use time management techniques like Pomodoro technique, working in focused bursts with short breaks to maintain productivity and prevent burnout. Next point, there is a sixth point, stay organized. Maintaining an organized workplace and keeping supplies readily available can save time and prevent errors. Use tools such as checklists, calendars, and electronic reminders to stay organized and manage tasks efficiently. Seventh point, adaptability and flexibility. Healthcare environment can be unpredictable and situation may change rapidly. Being adaptable and flexible, it is important for maintaining multiple tasks. It may necessary to reprioritize tasks based on urgent situation or unexpected events. Eighth point, self-care. Taking care of oneself is crucial to manage multiple tasks effectively. Ensure adequate rest, nutrition, and expertise maintain physical and mental well-being. Seek support from colleagues, supervisors, or healthcare professionals if feeling overwhelmed. By following these strategies, a healthcare assistant can prioritize and manage multiple tasks and responsibilities in a fast-paced healthcare environment while providing quality care to the patient.
Next point, what are the importance of teamwork among healthcare assistant? Teamwork is critically important in a healthcare assistant team for several reasons. Enhanced patient care. In a healthcare setting, teamwork ensures that the patient receives comprehensive and seamless care. Each team members bring their unique skill and expertise, contributing to the overall well-being and treatment of the patient. Collaboration and effective communication among team members lead to better diagnostic, treatment, and patient outcome. Improved efficiency and productivity. A well-functioning team can accomplish more in less time. By sharing the workload and coordinating responsibilities, team members can complete tasks efficiently and effectively. This allows for more time to be dedicated to direct patient care and reduce the chances of errors or omissions. Next point, increased knowledge and learning opportunities. In a team-based environment, healthcare assistants have the opportunity to learn from other different team members may have diverse background, experiences, and perspectives, which can contribute to a more comprehensive understanding of patient needs and treatment options. By working together, team members can expand their knowledge and skill and stay updated on the latest advancement in healthcare. Promotes professional growth. Collaboration within a healthcare assistance team creates opportunities for professional development. Sharing knowledge and experiences can help team members gain new insight, learn new technique, and acquire additional skills. This can lead to career advancement and increased job satisfaction. Fifth point, enhanced communication and problem solving. Effective teamwork requires open and honest communication with team members. Regular team meeting and discussion encourage the sharing of information, concerns, ideas, leading to a deeper understanding of patient issues and better problem solving. Through teamwork, team members can pool their expertise to diverse, innovative solutions to resolve complex healthcare challenges. Overall, teamwork is essential in a healthcare assistant team to provide high quality patient centered care efficiently and effectively. It creates a supportive and collaborative work environment that leads to better patient outcomes, professional growth, and job satisfaction. The final point of this presentation is, what can you tell me about safeguarding? Safeguarding is an important aspect on the Healthcare Act 2014, which aims to protect the health, well-being, the human rights of individuals. It involves taking necessary actions to ensure the safety and protection of clients. As a care assistant, it is my responsibility to provide high-quality care in line with the guidelines, procedures, and laws set out in the Act. Safeguarding involves preventing harm, abuse, and neglect. Also, it is a collective responsibility for all healthcare professionals. Thank you.